hear me now? Okay. So welcome to the Third Sunday Forum. Our conversation today is on caring, and Toni Mangskau and Jessica Lafaver are here to share their abundance of knowledge about what's available in our community if you are a caregiver for any reason. There are lots of reasons that you care for others. So I just want to give you a little background on Toni. Toni's a member of our church, and I have to have a list because there's so many things that she's done. She's worked for the Mayo Clinic for the past 34 years, and in the most recent position as cancer research. She's had prior experiences with Mayo Clinic nicotine research program and various community mental health and corrections programs, state legislative analysis, and a volunteer caseworker for local immigrant and refugee agency. She served on the American Cancer Society Cancer Action Network. And she's done so many things at the national, the local, and the state level, and has also been an advocate for a variety of health-related legislation at the state and the federal level. Thank you.
So doesn't every parent hear from their kids that you're talking too loud? Are you talking? So you think that you have a loud voice, but it could be just your kids telling you that. So, but thank you very much for the opportunity to come and share some important information with members of our church and members of our community. So this is a conversation that will be on caregiving, and just want to I have 3 goals for this. And the goals of this presentation are to increase awareness of caregiving issues. And then it is to provide some resources. Some of these resources are probably going to be ones that you have not heard about, but maybe of interest to family, friends, so you can share the information. And then the third goal is to plan. Where do we go from here? So just some statistics. You always have to start with statistics. Caregiving, about 1 in 5 Americans provide care to someone that is either an adult over the age of 18, or it could be a special needs child. 1 in 5. And so for caregivers of individuals over the age of 18, that amounts to about 48 million. And just something to keep in mind is that those numbers are only going to increase, and probably going to increase significantly in our community, because many of us are familiar with the Destination Medical Center. We have new patients that are coming to our community. As a result of new patients, they bring their caregivers. And I know our church is very, we're in a location where we have a lot of out-of-town visitors. And so just being aware of caregiving and some of this information may be beneficial. So this, let's see, it's a little light. So let's just kind of talk through. I'll read this if you can't see it because it is light, and I'm sorry about that. So as I mentioned, there's about 48 million caregivers for individuals age 18 and above. And the average age of the caregiver is around 50. So the average age of caregiver is around 50 years old. And the, let's see, I'm just trying to think of some of these statistics where the type of care that the majority of caregivers are giving involve helping someone eat, get dressed, and bathe. And it's like, that is really heavy duty type of caregiving. So again, it's just interesting to point out that the average age is about someone that's age 50. So it could be that you're caring for your parents, but yet you've got your own adult children, and then you may even have grandkids. And that's exactly what happened with me, where I was caring for my parents, and then I had my adult children with chronic health conditions that required care, and then I had grandkids that live with me on and off. So this amount of care has been valued at about $470 billion a year, which amounts to about 1/3 of the entire Medicare budget. This is a lot of care that's going on that is unpaid. And what was really interesting as I was reading through some of the latest statistics is that a lot of people that are caregivers, they may take a leave from their work. They may be taking time off without pay. They may have a job that, yes, you can get the family medical leave to cover your time off, but you're not necessarily going to get paid. And when you look at the numbers of how that is financially impacting caregivers, it amounts to about $340,000 in someone's lifetime that they are going to miss out on. And there are many individuals that have been caregivers that have to postpone their retirement. And that was a situation that I was in, where it's like, one year, I missed 1/3 of my income because of the amount of days I was taking off to care for my parents. So there is a huge financial impact. And one other statistic that you'll hear is about 6 in 10 bankruptcies are related to medical cost. 6 in 10. So a lot of times you have the patient that is the focus. But what is important is that you recognize that more than likely there's going to be a caregiver that at times is shouldering a lot of this responsibility of dealing with insurance denials, trying to figure out how are we going to pay our electric bill? How are we going to get groceries? Because this loss of income can impact the whole family. So it is taking a heavy mental toll. And this is a newer article that was out in Vox. But the information here is coming from our Center for Disease Control from 2020. So that during the pandemic, caregiving is really taking a huge mental toll on individuals, where you can see that the symptoms of anxiety are almost double for caregivers compared to the general population. And depression is about double. And then many individuals that were caregivers have started to develop substance use issues. And you'll see that the numbers are quite higher than the general population. And then the one thing, and the reason that I think that this slide is so critical is because about 1/3 of caregivers consider suicide. And that is something that I think needs to be raised to a level to where the public is aware of that. Caregivers are really struggling. The majority of unpaid caregivers, sometimes you'll hear that referred to as informal caregivers, tend to be women, but also individuals of color are providing a lot more in-depth care. So I'm going to share a short video that I helped AARP put together. It's about 2 minutes long on my family story, just to kind of give you a glimpse into what things were like for my family. And Oliver? My parents, they've always taken care of 7 kids. And about a year ago, the roles kind of changed to where my dad was hospitalized and my mom was also hospitalized around the same time. It was really tough because it's like I didn't want to be the one to have to make all these calls or set things up. And then I started to question, am I actually making the right choices? I think that we were looking for information, and I don't know if that communication occurred with other family members, but I know that there were times when my mom was dismissed or my dad was dismissed that we were looking
for resources, and we just didn't have it at our fingertips. There needs to be more support, and there needs to be one place that family members or caregivers can go for that type of information of what services are available. I don't know if that communication is occurring, but I didn't experience that. I will do anything to honor my parents' wish of wanting to be in their home, and between my brothers and sisters and I, we've done that.
So I just want to mention that I am so glad that I helped AARP with that video, because my dad died back in 2016. This is a video that was put together in 2015. So the numbers that were cited in the beginning of this video are higher than what you saw. But I have a video that I get to see my dad, I get to see my mom, and I just remember that was my childhood home where I grew up. So it means a lot. So as I mentioned, I've been caregiver for my parents. I have a brother that's here that his name is Travis, and 3 of us, a sister, brother, and I are co-guardians for him. And it takes 3 of us to keep up with you, Travis. So, and then as I mentioned, I've got 2 adult children that have chronic health conditions that they've been disabled at times. So what we can bring to the table for what is being learned for caregivers and for patients, it's so important that we are prepared. And I worked in the Cancer Education Center at Mayo Clinic, and I happened to be in the same area as an American Cancer Society navigator. And I was talking about the struggle that my family was having, in finding resources. And she mentioned that there's something in the state of Minnesota, which still is around. It's called the Minnesota Cancer Legal Line. So if you know anybody that has a cancer diagnosis, this is a phone number that you can call, and it will give you access to a lawyer that will help update any legal documents. Where my parents and I, we spent an afternoon up in the Twin Cities with this lawyer, where he updated my parents' wills, and he also drafted power of attorney paperwork. And then he created advance directive with us. And that was all at no cost. So there is a resource if you have a cancer patient that you know of, Minnesota Cancer Legal Line, very helpful. And what was nice, very generous for this lawyer, he didn't have to update my dad's information, but my dad and mom, they're a couple, so he did that. My mom was a cancer patient. So what we have learned as a family is that when our parents got sick, they were on adjoining nursing units, and there were 7 of us kids. We'd go and we'd visit with them. But when we got them back to their home, what we learned is there's a need for you to have an important conversation. And that conversation is asking the person that you're caring for, what are your wishes? What do you want to see done for your care? So we had a very important conversation. And one of the things that I brought with, if there is any interest, is something it's a care plan packet. And I'll talk about this in a little bit, but it can help get conversations started. But I am so glad that all of us came together as a family. We sat around tables. We talked about, what my dad's wishes were at end of life. He wanted anything and everything done. My mom was the exact opposite. She said, if it's my time, I just want to go peacefully. I don't want any medical intervention. And so if we wouldn't have had these conversations down the road, I wouldn't have known what to do when I was the one that was having to make these very tough medical decisions. And again, it's something you have to talk about this. You have to have those conversations. because if you're the caregiver down the road, I think that the advanced directive is something that I'd look at. And it was very comforting to me, to where as I was reading it, I could hear my parents. You know, I knew what they wanted. Very important to be prepared. So as I mentioned, I have a few care plan packets, and these are kits that the National Patient Advocate Foundation has put together. I do a lot of work on the federal and state level for the National Patient Advocate Foundation, AARP, and my activities tend to be around caregiving issues. And so in April, they started this campaign. It's called Be a Hero, Make a Plan. And this is a packet that you can use to guide you on starting those conversations. And the value of this packet really came into play when COVID hit, because you had a lot of 20, 30, 40-year-olds that were being hospitalized that people didn't know what their wishes were because it had never been talked about. So it doesn't matter what age, having those conversations very important. So I've got some care plan packets. It's not an advanced directive, which is a legal document that you get notarized, and advanced directives go on a patient's medical record. This is something to guide and start those conversations, but it does have information on who your doctor is, what medications you take, what your household bills are. And that way, if something happens, people can refer to that. You'll have designated who do you want to care for your kids if you get sick. So it can start those conversations. And this is something that I've connected with a lot of community organizations. I'm going to introduce our guest here, who's a great family friend. She works at Next Chapter Ministries. But then also Jeremiah program that was talked about back in July. And in a way, I'm kind of feeling like the Mangskaus are your frequent visitor, because my daughter was highlighted in the video for Jeremiah program. So here's another Mangskau. So it's something that Jeremiah program, Family Service Rochester, they are going to be using these care plan packets with their clients. And an example is if there's a medical emergency with one of their clients, this is a packet that they can have on their fridge, or they can hang it on the back of their front door. So if emergency responders come, you can refer to this packet. I've also connected with one of the staff at the landing, and we've created these care plan packets that are in pencil, waterproof pencil kits that individuals that are unsheltered can carry in their backpack, where if there is a medical emergency responders can look for that and know who they get their care from. Maybe helpful knowing who their emergency contact is and what medications they're on. So again, being prepared. And this is a way of starting that very important conversation. So when you think of being a caregiver, one of the things that the 7 of us kids were starting to talk about with our parents is how can we help with their household tasks that they have to do. My parents lived in a 4-level home that, you know, we had 7 kids in there. It was very big and they just couldn't keep up with things. So I want to, again, you know, my sister and brother are here. I want to let you know that we have the A team in the house. And for my brother Travis, growing up, one of his favorite TV shows was the A Team. And Mr. T was the main character, but in our family, Mr. T is my brother Travis. And so my sister Linda Travis and I, we would go down to our parents' house every Saturday. We'd have cleaning supplies. We'd make sure their laundry got done. We did their grocery shopping. And we made a list of what do they need done that we can help with weekly. But then there were some things that we had to hire help. And by hire, sometimes there are services in town that are on a sliding scale. So you may be eligible for some of these help, like through Elder Network. I don't know what my family would have done without Elder Network, because they had volunteer drivers that would bring my mom and dad to their clinic appointments, where I didn't have to take time off from work to drive to another town to get my parents to bring them in. These volunteer drivers brought them to the clinic door where I worked, and I was able to meet my parents. And it took about half of the time that I typically would have spent transporting and attending appointments. It saved me a lot of time, but it also saved me a lot of money because I wasn't losing that income by having to take time off from work. So Elder Network, we use Visiting Angels, Home Instead, which now I think has Home Instead has the same, but there's a lot of different agencies in town that, I mean, you can make a long list of different volunteer services that are in our community. So planning how you can help, but the most important thing is, as a family, we divided up the tasks so that one person wasn't shouldering the majority of the help that our parents needed. So we needed to know our limits. We needed to make sure that as a caregiver, we were getting rest, we were staying hydrated, and that we were listening to our body. You have to do that, as tough as it is. So here's a public thank you to my sister and brother. Couldn't have done it without, I really couldn't have done it without my family. Right. Yeah. We know why our parents had 7 kids, right? Okay. Yeah. So know your limits. And then one other question that may pop up, especially with COVID, and now Mayo, I know, has restricted visitors, but when I couldn't be at my parents' appointments, because I tended to handle a lot of the medical and legal stuff for my parents, but when I couldn't be there, I'd have one of my siblings would be bringing our parents or being physically with our parents. And then the provider, when they got in the room, they would call me, and I was able to participate in medical decision-making over the phone. And then via portal, but then also you can at times have a nurse care coordinator. So it's knowing who the contact is for the care team and having, making sure your questions are being answered. I always tell that of my patients, make sure your questions are being answered. And so there are ways to do that when you can't be close by. So ways of supporting people when you can't physically be with them to provide that emotional support. This was really tough because our mom reached a point to where she was in assisted living, and we did not see her for months, where she could wave to us from the window, but it's like we were not physically able to go and be with her. And that was tough because we were seeing her about 3 times a week, calling her every day. And very difficult when you can't see your loved one. So you got phone conference calls. We'd have many of us on the phone. We'd drop off food, always bring in her fresh flowers. One thing my mom loved were popsicles. So it's like, find out what their favorite thing is. We mailed cards just to let our mom know that we were not forgetting about her. So think about mailing cards. I would call my mom to say, hey, your favorite TV show is on. Make sure you can have staff come in and find that channel for you. And then one of the things that really meant a lot to me was being able to have time just to talk with them and reminisce. I have so many things, so many family stories now on just having a conversation about anything other than someone's health. So very important. Now, if you're looking for online support, and this is kind of a one of the things that when you think of caregiver resources, people will say, here's websites, here's phone numbers. So the Patient Advocate Foundation, which is the sister to the National Patient Advocate Foundation. I provide information on the Patient Advocate Foundation to every patient I talk to and their family, because they work with individuals that have any chronic disease or life-threatening illness. And if you have a denial letter from an insurance company, surprise medical bill, you know, which now I don't know if hopefully people aren't going to have surprise medical bills as much. There's some legislation that recently passed, but if you have any issues that are coming up, they may be able to assign a case manager that can help problem solve those situations. And they've got a large database of financial resources. And some of the financial resources, access to those may depend on your diagnosis, but other financial resources, it may not matter what your diagnosis is. And the Patient Advocate Foundation, they did have a COVID fund that was set up to help people. AARP is really leading a lot of national efforts on caregiving. And we need to raise caregiving up so it's more visible. Because as was mentioned earlier, there are so many people that are caregivers and it isn't talked about. The American Cancer Society, their phone line is answered 365 days, 7 days a week, 24 hours a day. I was able to access help through my employee assistance program, great staff. And then connecting with disease-specific organizations. My mom was on a cancer medication that was about $11,000 a month when she started. And then when she ended up stopping that cancer med, it had raised up to $13,000 a month. And again, caregivers are trying to make sure that the patient is taken care of, but yet at times they're shouldering a lot of that paperwork responsibility. And so one of the things that we learned is that the Leukemia and Lymphoma Society had a yearly grant that my mom could access. It was about, I think, $7,500 that they gave. And then when the price of her medication rose, they found a second grant to cover those out-of-pocket costs. So for these very expensive medications, there may be grants available to help cover what your portion is from your prescription coverage. Or it could be that a pharmaceutical company is going to put you on a program that you won't have any costs for medication. And I know that this seems to be patient focused, you know, of how do patients access meds, but think of the whole family unit. If the family has to decide, how are we going to cover that $600 and some a month for our out-of-pocket medication costs, it just impacts everybody. So resources can be very important. Caregiving. So I really like this picture where as a caregiver, you've got to remember to put your own mask on first before you help others. And so taking time, for me, I love music. Parents were musicians. And so when I'd be driving to the grocery store, I'd make sure I had my favorite music on. That was my time. That was my piece. And so find ways that you can take some time for yourself. And people say that, but yet as a caregiver, there's that need to acknowledge, yes, I need that, and to act and do something to take care of yourself. I did provide a lot of links for resources. As I mentioned, AARP has a lot of information based on your state on what resources are available. The American Society of Clinical Oncology has some resource information on caregiving for cancer patients. Patient Advocate Foundation, as I mentioned, is another resource. They do have a COVID fund. And then that care plan kit that I referenced is on the National Patient Advocate Foundation website. And then in our community, there's a couple resources that I don't know if they're as visible as what they could be. And that's through United Way, calling 211. Okay. And then the other resource is through AARP. It's the senior linkage line. But caregiving really is helping people from even before they're born, to make sure a mother has the support that she needs all the way through someone's life's journey. So what I'd like to do now is introduce my friend, Jessica Lafaver. She is the Women and Family Ministry Director at Next Chapter Ministries. And she came to talk to us about a couple of resources that you may not be familiar with.
Wonderful. Well, it's an honor to be here this morning. Like I said, like Toni said, I am Jessica Lafaver. I'm the ministry director for the women's program at Next Chapter Ministries. I am here though to talk a little bit about caregiving and just add to Toni's wonderful job. So part of what I have experience in is caregiving. My middle child, my daughter, was diagnosed with autism when she was just about 3 years old. And as a result of that, she had many in-home services and care. My mom has been a longtime PCA, was trained at the Southwestern Institute of Autism in Phoenix, and then moved here to help me with all the tag teaming that required. Christina is now highly functional and 20, and she's doing amazing. And the Mayo Clinic asked me straight out, what on earth did you do with this child? And I said, everything. So there were many resources that I took advantage of, and I also incorporated into my life. I had to. So part of that, it was MCRI. That's one of the fiscal agents that we go through to have in-home workers. So I'm a paid parent through MCRI, even to this very day. And before that, we worked with organizations like CUMC here in Rochester to help independent living for those with disabilities. And so if your loved one has a disability, those are just two resources here in Rochester that you might inquire of, with some of those on hands, tasks that need to be done every day in the home. Some of those caregiving things that I wanted to start off with that. The other thing is I am a volunteer chaplain for an organization here in Rochester that's a part of a bigger organization in the Twin Cities called Together for Good. So Together for Good is just a wonderful organization. They've only been around for about 2.5 years as an organization, but I wanted to just give you, as Toni said, we all start with statistics. So Together for Good is really it's basically for the local church to create pathways of support for families that are at risk. And so when parents face a crisis or chronic stress, children can be at risk. And we want to be able to work together. So it's not, us coming in, but it's how can we serve together? And so we don't want families to walk alone. Through COVID-19, that crisis has meant additional challenges, as you might imagine and know about already. Together for Good remains committed to coming alongside families that we serve. And so even though we're still limiting the group interactions, as it were, we continue to pursue social engagement with our active families through calls, texts, social media, video, Zoom calls, outdoor visits, hospitality meals, blessing bag deliveries, and then limited respite care and office hours by appointment. So if somebody wants to come in and kind of brainstorm through maybe a legal matter that they're going through. We have several notary republics on staff. That's been very helpful to our families during this time of COVID when some of the offices have been closed. Another thing that we do is we have trained volunteers that go through background checks, really on par with foster care, to care for the children in Together for Good. So as families, for example, maybe a mom just has, an overwhelming amount of laundry. Some of our volunteers have picked up that laundry, gone to the laundromat and done that laundry. Some other things that I can think of, moms who maybe have a therapy appointment or a recovery meeting to go to, or another a healing kind of endeavor. We have folks that have volunteered to take their kids into their home and care for them so that these moms and these families can access services that will help them in that self-care. And so that's something that, we've been a part of, and really through COVID, it has been life-sustaining for so many of our families. And so there were 4.1 million referrals to child welfare in 2017. I know that's a little dated, but it's even more now, 5 years later, involving over 7.5 million children. And those are the kinds of things that happen when parents are overwhelmed to the point of not being able to care for their own families or themselves. So Together for Good, like I said, is here in Rochester, and part of our goal is to keep kiddos out of the foster care systems and into basically their own communities, where their parents can still be involved and help and connect and care for them. Up in the cities, there have been Minnesota Adult and Teen Challenge folks who have gone into the long-term faith-based program as a result of host families being able to care for their children long-term. And so if that's something that you're interested in, I would highly recommend going to our website here in Rochester. I believe it's listed TFG rochestermn.org. And there is a Get Involved tab. And there are numerous ways you can get involved. It might be making a hospitality meal one time a month. It might be providing a blessing bag for our families here in Rochester. It might very well be that you have some time on your hands, or you may know somebody who does, that could serve as a host family, providing respite care for children in this area. And so, the reality is that thousands of families fall into that gray area where it doesn't really qualify for maybe a CPS case, but yet people don't necessarily take notice. And so what we want to do is, before they kind of fall off the cliff, as it were, we want to come alongside of them and help support them kind of back onto firm ground, if that makes sense. So Together for Good creates pathways for the local church to come alongside. And we believe that Christians are called to walk with the hurting, the rejected, and those who are in distress. We're committed to pleading the widow's cause and bringing justice to the fatherless. And so that's what we've been doing. We've done a couple different outreaches. We've done Backpacks for Good. School is coming, and so providing backpacks with school supplies for our kiddos and families. We've done Christmas. There was a Christmas program that we did. And, there's just been many, many blessings in the 2.5 years that it's been here in Rochester. And so if that's something that you feel like, gosh, I know that God's been wanting me to do something, or that sounds like an amazing organization I want to know more about. I know you can find several different little animates also on YouTube. They have a couple little 1 to 2 minute videos that explain a little bit more about what we do. So that's one thing. And then the next thing I just wanted to go by quickly is Grateful Life Ministries. So Grateful Life actually is shared space in the Lighthouse at Next Chapter Ministries, which is the women's programming house. So we don't have any women who are residential right now. But Grateful Life Ministries, our vision is walking alongside those on the journey of new life, making disciples through serving. And the mission is to help the body of Christ to be healthy, growing, and full of love. And so there are many opportunities in that spiritual mentorship focus, where we want to take the opportunity to maybe help equip and train those in the local church to become enabled to serve in many capacities. And so part of what we do, we help with life skills. We help with communication, marriage counseling. We do parenting classes and seminars. We offer doula seminars and training. So some of you may be asking yourself, what on earth is a doula? I'm a certified doula. Doula is one who walks alongside those on the journey to new life physically. So I accompany women through their journey of pregnancy, delivery, and postpartum. So it's non-medical birth support. So advocacy, information, comfort measures, and emotional support is primarily the function of a doula. But also it can be in childbirth planning, preparation, a lot of anxieties, especially with first-time parents or at-risk parents coming out of abuse, addiction, and incarceration. So in Grateful Life Ministries, we're in the process of actually training and equipping a team here in Rochester to be able to kind of be on call, as it were, for those who are finding themselves expecting unexpectedly, so that they can find that support. There are, statistically, at least 50% of those in the church as well as out of the church go to having abortions as a means to not deal with their unplanned pregnancy. So part of what Grateful Life strives to do is just provide support so women don't have to feel alone, unsupported, and afraid. And so many women have benefited from other local crisis pregnancy centers, but part of what we want to do here is be a part of the solution, not only in pregnancy, but through parenting and that whole journey as well. So Grateful Life Ministries and Together for Good also have a Facebook page. If that's something that you'd like more information about, or I'll be here afterwards as well. Thank you so much just for taking a few minutes and listening to about these organizations.
Always helpful to know about groups that are underway in our community, because maybe it helps us as a church think about what can we do to support members that may be struggling. And so just to kind of wrap things up. So again, the 3 goals for this were to increase awareness of caregiving, which now we know a lot of caregivers are struggling, right? And then it was just to kind of provide resources. I think you heard about a couple that you may not have been familiar with, but it gives us an idea of, is there something that our church can do to help support people? And then the other thing I want to mention is next steps. That's the 3rd goal. So currently on the federal and state level, there is an initiative for a Paid Caregiver Leave Act. You may have heard about the $3.5 trillion infrastructure bill. Paid caregiver, family and caregiver leave is part of that. There are states that have already passed this and have a paid caregiver leave in place. And I've been advocating for this in Minnesota since probably, I think, about 5 years or so, just waiting for something like this to happen. Paid caregiver leave, how it was structured is that it's run similar to an unemployment program, to where people pay in a small amount, which is about $40 or so a year that you pay into this fund, that if you would need to take time off to care for your family, you'd be able to have 12 weeks of paid time at 2/3 of your income. And what a difference that could make for families. And so that is something that is still being pushed. Another thing that, again, prescription cost impacts the whole family, not just the patient. And so really advocating for lower prescription costs. Hopefully that's going to succeed. And then one of the newest things that you'll hear about this fall is some legislation to create nationally individuals that serve as a financial navigator. And if someone is dealing with anything related to their healthcare journey that impacts them financially, this would be a person, an employee at a medical center that would be a financial navigator to help people work their way through issues that pop up. So that, again, it should be in the fall that you'll hear about something like that. A group that I've been connecting with is Age Friendly Olmsted County. How many in here have heard of Age Friendly Olmsted County? Okay. This is something that your state or local governments can apply to be part of this program that AARP is providing a structure for around the country. And I think it's about 3 years ago, Olmsted County was given approval to be an age-friendly member of this initiative. And I attended a meeting, maybe it was a couple weeks back. They're having another meeting this coming week, but there's been an assessment of what the needs are in Olmsted County. And now this group is getting together and anybody is able to join. People are getting together. I sat in a meeting where it had our mayor, county commissioner, city council, a lot of elected officials, but a lot of community organizations are also joining this group, because now it's how do we take that assessment plan and put things in motion to create an age-friendly community. And even though it's something that AARP had developed, it's from any time in someone's life's journey. Let's make our community something that meets the needs of everybody. And so I'm attending those meetings on behalf of the National Patient Advocate Foundation and as an AARP volunteer. But again, anybody is welcome to join. If you've got an interest in something and you want it to be something that has, you're wondering about support for getting an initiative in motion, this might be a group that you can connect with. So we've got a little bit of time for questions, but really, as I end this, the question is, as a church, how can we all come together to support caregivers? Because we know that there's a lot of people suffering that we're walking by, that we're sitting next to, and it's what can we do to really help people along the way. And we've got a group now for the healthcare workers, right, to support each other, but it's the informal, the caregivers, the family members, the friends that need a lot of support. And I'm hoping that our community as a whole, but also our church community, can step up and really see if there's something that we can do. One thing that I have envisioned is having a physical location for caregivers to be able to turn to that has resources. And I mentioned that in the video. So again, it's been something that I really wish that there was a physical place that I could go to that had information. So I welcome any questions. I'm just wondering, I should have asked this at the very beginning. How many of you are caregivers? All right, I'm seeing some hands. Okay, all right. So what kind of questions? How many were caregivers? Yeah. And yeah, it's almost all of us in here at some point have been caregivers. So what kind of questions do you have? Was this helpful? Is it information that was new? Yes. I do. I came prepared. I had my memory stick, I had my computer, I had paper copies, but I'd be glad to give this printout to you, and I'm sure we can make copies. So yeah, we can do that. So, and if anyone is interested in these care plan kits, if you've got kids that are in their 20s, 30s, 40s, help them get the conversation started. So what other questions? What other type of resources are you looking for? Yes.
Somebody who, visits with families, a lot of times the questions I get are, can you recommend a care facility? And can you recommend a home care agency?
Mhm. Yeah, so one of the things that we discovered was when we called a lot of the home care agencies, you had to pay for a 3-hour block of time. So it was $30 an hour, it'd be $90. And so one of the agencies, there wasn't flexibility, but another one of the agencies that we ended up having someone come in every day in the mornings, they said, yes, we'll bill you for an hour. So sometimes there's flexibility, sometimes there isn't. The staff that come in to help, there's such a difference. My mom, she was very selective in who she wanted coming in to help her, get dressed and, put her TED stockings on and everything. But we finally found the right match. So recommendations, sometimes it's word of mouth, right? Yeah. And then one of the things that we learned, which was, I just was in shock, really, was when my mom decided to stop her cancer treatment and we moved her into hospice. She was in assisted living, which even if your family members in some of these facilities, you're still a caregiver because you're still having to make decisions. But when she was in assisted living, stopped her cancer treatment, the assisted living says, we cannot care for her. It's just too much, it was way over what their threshold was. But yet the skilled nursing facility that we wanted to move her to said she doesn't meet our qualifications yet. So we were really in between. And the skilled nursing, these conversations, and I think I'm medical, but I didn't understand a lot that they were saying. And it's like, well, she has to need 2 people to transfer her in order to meet the qualifications. My mom was over 100 or under 100 pounds. She did not need 2 people to transfer her. So you get caught in the regulations or the rules or all of that. And so we wanted her to go to a hospice house. And Seasons Hospice is the only house that we were told about. And there were 8 beds. And it serves, I think, is it 4 counties? Something like that. Yeah, it's southeastern Minnesota. So you have to put your name on a list. You have to wait for an opening. And then the thing was, the Medicare will pay for the medical part of hospice, but will not pay for room and board. So it was $300 a day for our mom to go to hospice. We wanted her in a dedicated facility because we knew that the staffing was like 2 to 3 staff for 8 patients. But she ended up going to a skilled nursing. And it was the financial piece that it's like, we just didn't know how long we could afford $300 a day, because she was diagnosed in 2012. She did great for a number of years. And then she reached a point, COVID really made the difference for her, where she stopped treatment and she had exhausted all of her assets by then. It was, you got to spend down to get medical assistance. How do you afford the $300 a day? So that is something that I've reached out to our elected officials, and I'm like, it just can't be like this. People that are at end of life need access to hospice care, not to be in a skilled nursing where staffing shortages, where she was at, half the staff were temporary workers, were changed every day. So we've got a huge staffing shortage, and we were told, well, you can take her home, but that wasn't practical because a lot of us are working. So lots of issues come up with care planning. And I am not shy to talk about it and with our elected officials. And I'm just going to put it on the table, say this is what we're running into in our community, and help other people feel that they've got this voice to share their experience. That's a great point. Yeah.
Are there resources, Toni, that you know of that would say something like, here are some of the questions to ask of a care facility? You know what I'm saying?
I do. Yeah. And I think AARP is probably going to be the website to go to for some guidance on that. Yeah, it is so tough. When we moved my mom into assisted living, she went from a 4-level home to be on a wait list in Rochester for independent living, which was a couple of years, 1 to 2 years of being on a list. So we moved our parents to Zumbrota, and they each had a 1-bedroom apartment across the hallway from each other. Well, that was good because they could have their own space, right? They could check on each other. They're still in contact. But we were driving further to be able to help them with their day-to-day needs. And then eventually my dad ended up making a decision to stop his treatment. He had heart and lung end-stage disease. And so he moved into hospice at Homestead. And when he moved into hospice, my mom's name went up in priority for High Point. And she was able to get an apartment there. And then she just walked down a sidewalk to visit with her dad. So hospice, we have great facilities compared to a lot of places in the country. Or skilled nursing, I mean, but yet the staffing shortages are just heartbreaking. Just heartbreaking, yeah. And that's another thing where it's like we've got informal caregivers, we've got caregivers that work in medical centers, but sometimes the group that's being missed are the direct service providers who are working in group homes. And they're having a huge staffing shortage. And I know Olmsted County has pulled together people. I attend meetings on how do you address the staffing shortage. Mm-hmm. What other questions? Was it helpful? Any question? Yes, Eileen. Yep. Okay.
It's my observation that we have come a long way in working with persons about end-of-life preparation. I'm not so sure we have a very good understanding of helping people come up with the knowledge that they're going to be in aging process. They're going to have surprises, and they're going to have crises, and they're going to have situations where they have to make big decisions, and they don't want to think about it.
Right.
That it's sort of putting on a attitude of, well, that is true, but it won't happen to us. And so I think one of the things the church can do is try to help people get some understanding of the stages. I felt when I was doing caregiving for my husband, what was really the challenge were the transitions.
Right.
Yeah, I mean, the day-by-day things started to get down, and then something would happen. It was a big transition. And all of a sudden, there were these other decisions to make.
Right.
If there was some way to approach what are the points of decision you're going to be needing, and helping people get prepared for that before it happens.
Right.
Because then you're in a situation where everything's up for grabs.
There are palliative care teams that both my mom and dad were on palliative care. And palliative care is an extra layer of support for the patient and family, where there was a time when my mom had 2 specialists that couldn't agree on a treatment, and the palliative care person who was covering the hospital service just came in and said, you guys can't agree, this is what we're going to do, and just kind of address the symptoms that my mom was having. Palliative care can be very helpful support for family when you have questions that come up and you don't know what to do. But one of the examples of what you're mentioning of crisis, as I mentioned, my brother Travis, there's 3 of us siblings that are co-guardians. And Travis went into the hospital one time. He was in the emergency room. And we were trying to advocate for him on, this is big thing, get him in a room. And he ended up where he coded, for he had to, they had to intubate him. We had to make decisions. Do you want all this life-saving stuff done? And I was in shock. I'm like, wait a second. I thought he was just having like some stomach pain. And all of a sudden it's like, you've got, this team coming in, they're intubating, and he was in an ICU for weeks, multiple surgeries. And I wish I would have had someone that could have walked me through and helped me feel like I'm pulling myself through that state of shock, because those were tough decisions to make. And I am working with the University of California, San Francisco on medical decision-making. I've been providing some input from a patient caregiver perspective for this project that they're working on. But it is very important, of my mom, and dad first diagnosed, and then needing assisted living, skilled nursing, everything changes. And the financial piece changes. And no one really can understand that financial piece at times. So I'm right there with you. I think there really needs to be that support, because it is a state of shock. And you're also, it's that grieving, that you're feeling. And if you don't have time to process those feelings, I mean, who's going to benefit? No, it's just a tough place to be. And I do agree with you on that. Yeah. Yes. Yeah.
I appreciate all this information. 3/4 of the time to do this, I've been thinking about caregiver for my husband. Now it's done, and my husband is working with her husband who has severe cancer.
Mhm.
Where do I back up now and suggest she start looking to see if maybe there's a service she's not?
Mhm. The agency in town that I think was the most helpful for they've got such a broad range of services, Family Service Rochester. With what age range? Okay, so Elder Network, they may have like a handy person to come in and do home repairs, volunteer drivers, just the, I'm impressed with the services that Family Service can provide at times. And Family Service Rochester, yep. And some of those are on a sliding scale. But the other thing is 211, calling United Way and just asking, I'm looking for this service. Where do I start? There is an individual in town that has created an Excel spreadsheet of 150 different organizations in our community, who the contacts are, what the services are. And I'm trying to see if he can release that so that we can have access to that information. Because there's a community directory, but sometimes that's not the most up to date. Family Service Rochester, I think, was really very helpful. Yeah. And I saw a hand.
I was wondering about the access of the caregiver to the doctor of the patient
Mhm.
or the medical service team.
Mhm.
I know my experience 20 years ago was, you can't talk to those people, you can't communicate. I know my dad had shingles,
Mhm.
and my doctor said, "Oh, acyclovir is so expensive." Well, he had great,
Mhm.
pharmaceutical insurance.
Yeah.
And this type of thing, and I was really frustrated. Has that improved Or the doctor, so I know part of it was.
Right.
At the time of the thing for death panels. and
Oh,
all
right.
this, and you couldn't advocate for someone
Mhm,
because that might be seen inappropriate.
mhm.
And that is frustrating.
Yeah. So I get a lot of my strength of feeling like I need to speak up by attending webinars and learning about, from other individuals. My difficulty is, yes, I work at a medical center, but yet I'm also a patient. My family members, I'm their caregiver, I'm their advocate. It has been tough at times for me because these are a lot of the medical staff I directly work with, so you just have to, you got to make sure that your questions are being answered, and you've got to feel like you know what your options are, you put them on the table, you get some guidance. Your feet need to feel like they're firmly on the ground. And I speak up. And I think that you need to. And we have asked for different physicians. It's a little tougher now to switch your provider, but you got to find someone that's a good fit. And if you are not feeling like that communication is easy flowing, I've worked with a lot of the nurses, and they are strong advocates at times. So I think it can depend on the situation. Yeah. But I definitely want to make sure that the questions are answered. Oh, yes.
I'm
Yeah.
thinking that when someone is hospitalized, that the patient can tell the staff who they want information released to,
Mhm,
so that it's not, they now have to tell every family everything.
mhm.
They can tell one family member, they can share it.
Right.
I'm not sure.
So the video that was created was to help pass something that's known as the CARE Act. And the CARE Act did pass in Minnesota, and it requires that you can state who your caregiver is. The caregiver is supposed to be notified if you're going to be discharged, and there's supposed to be some educational training on what the care needs would be after discharge. So you can designate your caregiver, and then that communication should flow from the healthcare team. Yeah. And there are wallet cards that you can actually carry. You wrap them around your insurance card, and you can hand it to the care team just to say this is, something that you want to have followed. Designate the caregiver, and the communication can flow, and the training. I was surprised. My mom, she went home one time on an oral chemotherapy, and it was one that you don't touch the drug. If you're not the patient, you have chemo precautions, all this stuff. And I work with cancer patients, but oh my gosh, this was a lot to learn, because it's like, I don't do that type of stuff with patients. I have learned to change dressings and just, you name it, because people aren't seen in the hospital as long as they used to. Yeah. So the CARE Act is something. Yeah. Does that help a little bit? Okay. And I know we're over, but I love talking about caregiving. Can you tell?
Proactive in the Care Act to, am I automatically my wife's caregiver? No.
I don't think, okay, so again, I came prepared. This is a wallet card that you can carry. You put it with your insurance card, and it talks about the CARE Act requires hospitals to provide your loved one the opportunity to designate a family caregiver in the medical record. Okay. Notify the family caregiver when your loved one is to be discharged to another facility or back home, and give description and instruction of the medical task that the family caregiver will need to perform at home. And so you can actually carry this. We can make copies of this. Yeah. Yes, Linda.
I just kind of want to get back to, just looking back at the end of life. I think in this community, we focus so much about trying to keep people alive as long as possible. I know a lot of research and all that, but at what point does it become, it's a question of quality of life. And I'm even looking back at Mom. I think the last whole year or so that she was going through these treatments, she was not living. She was so unhappy, but she did it for us. But I think we really should focus more on educating people on more that end of life, what to expect, like Aileen says, and not so much trying to keep people alive at, the expense of their quality of life. And it was really, as a caregiver, one of the hardest things was that end of life time when we learned that, of course, I don't think people really fully understand hospice services. And the fact that for southeastern Minnesota, there were only 8 beds to serve, our mom didn't have a home to go back to. But the other thing is that you don't get, unless you're in like that season's hospice, I mean, you're dependent on the care of that facility you're at. I mean, you might get hospice, Seasons or Mayo coming in 2 times a week. It's not like a physical location that you've got dedicated hospice people trained on end of life. Let's help these people die with dignity. And we need more physical space for hospice.
Yeah, I've got a story just to share to kind of wrap things up. And I know we're over.
Just have one question,
Yes.
one thing. I look around and we're all aging, we're talking about end of life, but there are circumstances, and I would hope that people would talk to their children or nieces or nephews that are younger. And because there are circumstances where young people need to take care of this issue. With COVID,
Right.
but also, I remember a couple of years ago, we did something about end of life too. And one of our members in the church, her husband was out running and he had a heart attack. And fortunately, someone noticed this, and she was a young mother with young children and having to make decisions. Fortunately, it was a good result, but you just don't know.
Right.
So
Yep.
young people don't think about that at that age, and yet it's so important.
Very important. Very important. And that's where that care plan can help start those conversations and provide that guidance that might lead to someone creating an advanced directive. So, but yeah, COVID was a real eye opener on the need.
Conversation. If I had not had that conversation that very first time that we had to decide the DNR thing when Mom was hospitalized, and
Do not resuscitate. Yeah.
and that difficult conversation, and when she said at that time, Linda, I've had a good life. I wouldn't, I've had a good life. That's all I needed. I just hearing her say, I've had a good life, I wouldn't do anything different, that she was content, but that comes out maybe hopefully in some of the difficult conversations.
Right. We were lucky. My mom's parents were morticians. And so she, as a teenager, would drive her dad out to accident scenes, and she really was familiar with death and dying. And so one of the comforts that she provided to us was when I'd leave the hospital and I knew she was going to get a chemo treatment, she would look at me and say, I've had a good life. And I knew if something happened to her, that she really was at peace with the dying part. And that's what we need. We need to have those conversations so that people feel comfortable with end of life for others. Yeah. I hope that was helpful. Yes. Yeah. Yeah.
thank you, Jessica. We appreciate all of you for coming and sharing all of your knowledge. Thank you.
Thank you, everyone.
We're available